Great. Hello, everyone. Thanks for joining us. We're going to get started in a few minutes. I'm just going to give it about 60 seconds or so to let people join, and then we'll get started. All right. I think we've got enough folks joining, and hopefully everyone will join in a little bit who's lagging, but welcome to the Healthcare Pulse Speaker Series hosted by Manifold. We interview leaders transforming the future of healthcare. I'm Jordan Katz. I'm a partner at Manifold, been at Manifold for about a decade now. I spent the majority of my career at the intersection between technology and health. I work with a lot of our clients around technology readiness for value-based care, specifically related to data management, interoperability, and change management services. I also spend a lot of time with our clients related to emerging technologies like generative AI and how that can help improve quality of care and reduce cost of care. A quick little bit about Manifold before we jump into the discussion, but Manifold's a venture holding company. What does that mean? We have a investing and incubation arm. In that investing and incubation arm, we invest and incubate early stage software and data analytics companies, primarily in the healthcare space. On the other side of the house, we have a technology services business where we do advisory, build, and implementation work, primarily in the healthcare space and primarily for health systems, hospitals, and payers. And then we also operate a Slack community of over 200 executives in the healthcare technology space. If you're interested in joining the discussion there, we'll share the invite in the link of the chat kind of during this and after as well. So enough about me and us, on to the discussion today. Today I'm joined by Dr. Luis Taveras. Dr. Taveras is SVP and CIO for Lehigh Valley Health Network. I'm certainly not going to go through his illustrious career and list of accomplishments, but just a couple quick things here. Dr. Taveras is a top 30 CIO in the US. He's an advisor to the Wall Street Journal. He's been SVP and CIO at multiple healthcare systems. He was a senior partner at Accenture. And then we were just talking about his stint as a CIO for the city of Buffalo and his what he says, 2 winters that he spent in Buffalo. Dr. Taveras also recently authored the book, The 90-Day CIO, Strategies for Optimizing Outcomes and Value. We'll talk a lot about that today in today's discussion. So, Dr. Taveras, welcome.
Thank you. Thank you for having me here.
Thanks for being here. So let me kind of, we'll shape the conversation, Dr. Taveras, and then we'll go from there. So we'll start off at a high level. We'll talk about the key components to moving to a value-based care system as we live in this fee-for-service world, and specifically that shift from fee-for-service to value-based care as a CIO. We'll talk about then from there, we'll kind of drop it down a level and talk about some of the specifics within that foundation related to data management, interoperability, governance, and PMO. And then I know a topic that you're certainly super excited about to discuss is leadership, which is key to doing all of that. And then we'll get into and spend the rest of the discussion. We'll have a lot of fun, hopefully talking about kind of how innovation related to the role of CIO and how to kind of flip the script and flip the idea that the IT group is just a cost center in an organization, and that they can actually be a partner and a value driver for the business. So that's what we'll cover today. Feel free to drop questions in the chat, and as we are going through the conversation, I'll grab a couple of them and certainly use them to help fuel the discussion with Dr. Taveras. So, all right, sir, let's get into it. So first and foremost, we were talking about this before. Value-based care. It's a big statement. There's a lot of nuances to it. There's a lot of different definitions of it. and I think everyone on the call obviously knows what it is and has their own kind of thoughts around it and whatnot. But I'd love to kind of get your thoughts related to how do you define value-based care and how do you think about it?
So this is not a textbook definition. This is kind of the way I think about it. So I associate value-based care very much with population health management because it's really about making sure that you provide the best care for your patients at the best value that you can bring in the most affordable way. Right? So you have to think about your population that you're managing, all your patients, and how do you manage the risk of that population such that you provide the best care in the most affordable way. Right? And there's so many different strategies to doing that, but it's really making sure that we're very efficient, right, and very proficient in the way that we deliver care and how we charge for the care that we deliver, how we compensated for that. In a lot of cases, for example, in the case of the Affordable Care Organizations, the ACOs, you're looking at the government incentivizing those that really do a great job doing that and stand out from the rest of the pack, and not so much penalizing, but you don't have any incentive if you're at the other end of that curve. Right? So that's kind of my way of thinking.
Yeah. So let's talk about if it's about managing patients and improving quality of care while at the same time driving down costs from the CIO POV, kind of blocking and tackling. What are some of the core components that you have to think about as you prepare for that kind of shift of the infrastructure?
So we need to focus on understanding our population as well as we possibly can. We have to have the ability to risk stratify that population and look at the diabetic population, for example, right? If you look at those that are 7 or higher in terms of A1C, right? That's your high end population. Those that are 4 to 6.5 or so, right? That's your middle risk population. Those below that are the low risk population. You have to have the ability to manage that population and have all the analytics and all the technical capability to say, how do we get our 7 plus to come down to the middle risk? And how do we get the folks that are in the middle risk to come down to the low risk? And that means that we have to understand where they sit, and then what are the things that we're going to have interventions on and assisting our clinicians to provide the innovations to lower their risk scores. So you look at things like being able to provide gaps in care. Right? We have to put it in the physician's face that this patient needs to come in and have their eye exam. They need to go visit a podiatrist, right? So it's those type of things that we have to make sure our systems are capable of doing. Not wait for the physician or other providers to ask for, but really to proactively provide that information so that can proactively manage the patients. That's the other big part about value-based care. We have to be very proactive in managing our patient population.
Yeah. So patient population management and especially risk stratifying patients, it all comes down to having good quality data and being able to pull your data together. Can you talk a little bit about more like your perspective on pulling that data together from disparate systems, and things like that? Because obviously that's kind of the key to the foundation.
Yeah, so we're fortunate that we're on Epic. So a lot of that data resides in Epic today. But if you're not, then you're going to depend on your HIE or other ways to get the data for the patients. And even in our case, right, sometimes our patients don't come to our facility. So we do depend on us organizations to provide that because you absolutely have to have a complete picture of your patient. So you got to aggregate all that data from wherever it is. In our case, again, 90% of that data resides in Epic. So we're in better shape than a lot of other organizations, but you still need to have the facility to aggregate that data so that you can take the proper actions.
That makes sense. That makes sense. What about just related to that, as you talk about some of the different systems, interoperability being a key part of value-based care, and from the CIO seat, what are some of the things from a technology standpoint that you think are critical and that you need to kind of invest in as you're building this out?
So from an interoperability perspective, again, we happen to be in a region where Epic is prevalent, right? But if you are in an area where Epic is not playing, where you have 5 or 6 different large organizations that have different EMRs, right? Now you have a different issue to deal with. So the uh, the advancements in ability to share data with FHIR and other different protocols that we can now use have been tremendous in terms of doing that. The HIEs, despite everything that's happened with the HIEs, they play a pivotal role in that case, because in those cases they don't have all the data together, and the physicians are looking at different pieces of data which are difficult to interpret if you don't have it all together. Right?
That makes sense. That makes sense. So we'll kind of drill down for a second into, we talked about data management, we talked about interoperability and risk stratifying your patients. Obviously that requires the need to collaborate across different departments within the company, PMO and governance and leadership. Do you want to talk a little bit about how your specific examples, but kind of how you think about that?
So in terms of the PMO and the communications across the organization, we need to develop, and this is whether you've been around for a long time or whether you're just starting as a CIO or whether you're just reorganizing an organization, we really need to focus on creating the right culture and creating that right culture that communicates a lot, that believes in collaboration, and that believes in making sure that everybody's focused on one thing, and that is providing the best patient care that we can provide to our patients. That also means making sure that we provide the best information so that our colleagues can do their job, right? So that's where it comes down to creating that culture where everybody's focused on making sure that we all have the right information whenever we're taking any action for internal reasons or for patient care reasons.
Makes sense. Obviously, there's different ways to create culture from a change management perspective, top down, bottom up. I'm sure you've seen both. Do you have kind of thoughts on it's not necessarily an either or, but just thoughts around those two techniques.
It really starts at the top. It has to start at the top, and that's why when we start talking about the 90-day CIO, it's a very prescriptive way of looking at a way to really create a high performance organization and a high performance culture. It needs to be that the CEO and the members of the CEO Council are driving this change. For us to create the right culture requires significant change management and requires a lot of discipline in the organization. And those things have to come from the top.
That makes sense. So a little bit of a shift here, but there's the culture and the caring for patients, and then there's the pressure on profits that comes from sometimes private equity or sometimes the street and things like that. Can you talk about how you've been able to kind of thread the needle and reconcile the two? Because oftentimes they kind of butt heads against each other.
Yeah, all the time, right? No matter if we're nonprofit, but even if you're for profit or nonprofit, it doesn't matter. We still have the same cost pressures, right? So when you look at the IT organization, the main thing that we have to get people to understand is that the old way of thinking about IT no longer applies. IT used to be an absolute cost center, right? And I took the fact that when I first started my first CIO job, of course, we were in the basement of the hospital in New York City, right? And we were always right next to the morgue, where it got pretty cold if you got a little too far. So I made sure people understood that we were next to the morgue. But in those days, we were absolutely looked at as a cost center, and appropriately so, because all we did was administrative computing. Right? But when you look at after 2000, but really 2010 or so, and when meaningful use came into effect and all those things that we had to worry about, and we started moving computing into the clinical space, things change. We're no longer a cost center. We're a vital way of providing care. So when people say, how much are you spending on IT? No. How much are you investing in IT? It's an investment. And we have to make sure as CIOs that we bring the right return for that investment that's being made on us and our team. So that's key. We need to think of ourselves as an investment the organization is making and realize that they can use that money to build a hospital, to open a new clinic, right? Instead, they're investing in us in IT. So we have to provide the proper return in terms of value to the organization and improving the outcome to our patients and their families.
So obviously, kind of changing that narrative from an IT perspective requires managing up into C-suite and then potentially to the board and things like that from sometimes from an investment standpoint. In your experience, do you have examples or kind of tips and tricks that you've used to push that message up and show the value of IT versus it just being a cost center?
So a big part is making sure that you have the right governance in place. One thing that I have found pretty much in every healthcare system that I've been the CIO is that unfortunately we don't have the discipline that we need from a financial perspective and from an investment way of thinking about it. So that's the first thing that I put in place. Number one of the undisciplined parts that I usually find is that anybody in the IT department can sign contracts. So when I get there on day one, the message is pretty clear. I sign the contracts. I commit the organization to future payments on something because I need to have that I need to know where the investment is going. The second thing is you got to create the right governance model. And the right governance model says if you have something simple that you need us to do, send it along. We'll take care of that. But if you're asking for a project that's going to require significant investment, I need you to produce a business case. And of course, most folks in the hospitals are not used to doing that. So we provide guidance. We give them a template and we provide guidance on how you're going to create that business case. If it's a business case for a clinical solution, then it goes to the clinical steering committee, which is a group of physicians in the organization that are going to review that. If it is a business or operational type of item, it's going to go to the business steering committee. If those committees approve it, then it goes to the executive steering committee, which is the top of the organization. And if they approve it, then it goes for financing so we can get the proper financing. And now it became a project. So that's the discipline that we have to have especially nowadays with the cost pressures that we have. That is the real discipline approach that we have to follow in terms of managing investment. If you just continue to spend the way you've been spending, you can't change the discussion to say you're investing. Once you say I need a business case, you're kind of changing the tone of the discussion.
Gotcha. So to your point, like you first kind of coming back to my managing up conversation, you first have to prove up that you've got strong discipline, and the typical tendency of C-suite is to think about, again, IT as a cost center, but also, hey, most of the projects in IT always go past the timeline and go and have cost overruns. And if you can build that and help kind of solidify to the management team that that's not going to be the case, that you're going to manage things appropriately, that's probably foundation number one. Now maybe talk about like the next step. Once you've done that within an organization, I'm kind of papering over it like it's easy. It's certainly not an easy thing to change the culture there. But once you've done that, what's the next step now to managing up and getting C-suite and the board to think about making investments in IT?
So, John, go back to what you said about getting this done and the fact that it's not easy. And the big part of this is the message that you gave there, which is if we say we're going to deliver on November 30th, we're going to deliver on November 30th. And we can say we're going to meet this budget, we're going to meet this budget. The third component of that, though, is that if the business says or the clinical department says, guess what? As a result of this, I'm going to do X, Y, and Z. I'm going to lower my costs. I'm going to have 10 patients more per day that we're going to see. All those type of things, the benefits that are in that business case, we have to make sure they deliver on those benefits. Because what typically happens is once a project is approved, right, we forget about it. We go through the implementation and then we don't hold people accountable for what they say they were going to do for the organization. So we have a process for making sure that we hold people accountable on an ongoing basis for what happens. The next step that you mentioned is we need to really engage the top of the organization. So we developed in that first 90 days or whatever 90 days it is that you're working on, we developed a strategic plan. And that strategic plan is for the next 5 to 7 years from an IT perspective. that strategic plan needs to be such that the CEO and everybody across the top of the organization is actively engaged in developing that plan. At the end of that, it can't be that Luis or the IT department have their plan. No, it's our plan. And if they see their fingerprints somewhere in that document, right, they have some sense of ownership. So it's critical that we engage the high level and that they feel ownership and participation in developing that plan, because then they'll help us implement it. A big part of that plan, obviously, is the governance model that we just talked about.
Yeah. Do you think that given kind of the shift in from fee for service to value based care, do you think that you see kind of more of that executive leadership team being much more proactive and involved in that plan because they recognize that they need to make the investments in kind of the core blocking and tackling before they can get to some of the ability to risk stratify your patients and provide better care for those high risk patients?
Yeah, no question about it, because what we're doing is bringing a disciplined approach to everything we do, and that's the same kind of disciplined approach that we have to have with the clinical areas, where we're actually caring for the patient and managing the patients. So it's not unusual for me to implement these rigorous processes and for other departments to copy them, which is great, right? It's great to see other people say, "God, if you guys can do that kind of discipline approach, we want to have the same discipline." And then the leadership catches on and says, "We're going to turn to this." That's that culture building, right? We're going to turn to this different way of doing things.
Makes sense. So let's move away from a leadership standpoint into kind of once you've convinced leadership to make investment and you're aligned from a plan perspective and you've shown that you can deliver that delivery aspect of things. For example, at Manifold, we've had a lot of experience and a lot of we do a lot of work kind of bridging the business into IT and making sure that like during implementation and making sure that they're kind of in sync together and keeping along that lines of the business plan. How do you oftentimes when you get to project keep the business informed or have the business keep their fingerprints all over? Do you have a team that kind of sits in the middle often? Do you use outside resources? How do you bring those two along in the journey throughout?
So we do use outside resources where we need it, but not in excess, because remember, we're managing costs here, and we know that the outside resources are going to cost a lot more than our own resources. So we are very judicious in the way that we use consultants. But how do you keep the business engaged? Every major project has a small steering committee, and they drive the project. It's not putting it on our table and saying, "Let me know when you're done." No, no, no. You're involved on a weekly basis, and we have to. One real key piece for all these projects is status reporting. Every Friday afternoon, we prepare and send to the leadership an executive level status report. Very simplistic, and I'll give you the example here. So it's really 4 quadrants. So the upper left is what did we accomplish this week. The bottom right is what do we have planned for next week. The bottom left is the issues that we're managing, and the top right are things that we're escalating to you. That's it. That's really at an executive level what you need to know every Friday afternoon to tell that the project is doing well. We also have a key that says we're green, we're yellow, or we're red, right? So you can quickly look at that and determine where you are. But it's absolutely important that you provide those status reports, because that's how you're going to keep people engaged. And if any issues are cropping up, they're going to know on a weekly basis. So that's the level of engagement that we need.
Yeah. So let's talk about risks and kind of from a leadership perspective, that culture of transparency. How, what are your thoughts and how have you seen both like how have you seen it kind of go wrong and then what are some of the things you think about when you try to advise people or think about that culture of transparency to highlight risks?
So it's 2 parts to it. Is definitely transparency, but it's also accountability. Everybody knows that we are going to be held accountable, right? And we're going to hold ourselves accountable, but we're going to hold other people accountable. A lot of these projects go away. Why? You guys do this all the time because the business doesn't belly up the people they say we're going to belly up, right? They don't provide the resources right, and that's how we get behind. So That's the reason for continued engagement. That's the reason for the transparency, because that's what's going to drive success.
Makes sense. Just a quick note here. If folks want to drop questions in the chat, feel free to drop questions in the chat. Let's talk about kind of just to pull back into IT in general and metrics that you think about from a performance standpoint, and how you key metrics that you think about that ultimately get reported back up into the broader C-suite and into the board. What are some of the key things that you think are critical for you to be measured on, and then for you to make sure that you drive on?
So I want to be measured. Obviously, budget. We can't get away from that one, right? So that one is a given. But there's some other operational measure and strategic measures that I want to be measured on. For example, going back again, when I arrive at an organization, I usually find that organization to be a very reactive organization. And people usually ask, so how do you know that it's a reactive organization? What are the symptoms, right? Well, the symptoms of reactive organization is not very much communication, right? Lots of silos within the IT organization, not great processes. They certainly don't follow ITIL processes, anything like that. So not great processes, and not really investing in the people. Because if we don't invest in the people, how can we ask for them to produce 100% or more than 100%? If you everything, the first thing you do when it comes to budget cutting, you cut the education, you cut the traveling, you cut the training, right? That's the last thing that I cut, because we have to make sure we invest in the people, since so much is required of us. So the other big measurement for me is from that standpoint is, how are we moving the needle from that reactive organization to more of an operational excellence organization, and then on that journey to high performance? How are we doing with that? And there's different measures to that. Number of tickets. I've come to organizations where they have so many outages, and when I've asked them, can you quickly do an analysis of how many of those outages were self-inflicted? Right? How many were because we didn't have a good disciplined approach to doing it, because we were just too fast to change things? And I find that a lot of time, 50-60% of those outages are self-inflicted. So imagine what would happen if we implement these processes and these disciplines and did away with most of those self-inflicted issues that we have. How much more time do we have to do value creation activities? Right? So those are the type of strategic measurements that I like to report back to our team. Nowadays, by the way, you have to report where you are with cybersecurity. We can't get away from that. So I provide on a quarterly basis to the board where we are with cybersecurity and the management of risk. So that's another one that it's kind of a given these days. You definitely should be reporting on at least a quarterly basis where you are with cybersecurity and protecting the organization.
Yeah, that makes sense. Do you have thoughts on and I'm not sure your experience related to this, but there's so many health systems right now that are growing via acquisition and stacking different systems on top of each other with disparate systems, Epic, Cerner, WellSky, different things like that, and then consolidating into one IT department and whatnot. Do you have thoughts on how to kind of the culture and some of the foundational stuff? Do you have tips and tricks or thoughts around how that can work in a culture of acquisition?
Yeah, so go back to the where we started, which is value based, right?
Yeah.
If you have this disparate environment, and we need to have great information about patients, you're making it much more difficult for yourself to do that. So the key thing when these organizations come together is to make sure that you get to one set of systems. You go through that inventory at the front and say, we have 3 or 4 different EMRs, but in the right-hand column, which is going to be the systems it's standard. So you want to make sure that you get to that right-hand column at least within a year or 2 years of coming together. Because if you're really going to be an integrated organization, that's what you have to do. If you're going to be a holding company, which doesn't really work in our environment, right? In that case, you're going to struggle when it comes to value-based and other things that we have to do to really provide great care to the patients.
So tactically, does that manifest itself in as quickly as possible, really getting your understanding of your current state architecture, and then designing kind of the future state, and then also kind of going through, we call it like app rationalization projects, things like that.
So we're going through a major apps rationalization process now. But if you do come together with another organization, that's one of the first things that you're going to have to do. You're going to have to map out what are your applications, what do you have in common, and then based on what you have in common, where are you going to go as a system at the system new standard. Right? So that's one of the first things that you really have to do. Other than, again, go back to cyber, right? Make sure that you address cybersecurity first. That you don't bring somebody into your organization and put them into your network and you just open a ton of doors, right? No, that you can't do that. So cyber would be first to me, and then application visualization is definitely second.
Right. Yeah.
And we refer to it as applications, but it's more than that, right? So it's applications and it's all the environments that we have.
Right. Yeah. So maybe just comment a little bit on how. So cyber for sure. The second part, though, I think is we've seen across in the industry, there's a desire to do that from system standpoint, but the business or the organization is just moving at lightning speed from an acquisition standpoint. How do you kind of thoughts around catching up, or how do you kind of keep that running in parallel with and keep up with the speed of the organization? Because I think that's also another misnomer oftentimes of IT, Dr. Taveras, is that everything takes forever and it's so slow and ...
So that, to me, the main thing is make sure that as a CIO, you're part of the team that's making those decisions. Because a lot of people will come to us, oh, we just bought a practice. Well, yeah, that's great. How long have you been talking about it? How long have you been thinking about it, right? You started talking to those folks maybe 3-4 months ago, and now you're coming to us and saying you got to bring us up on the same system in 2-3 months. No, if you started talking to them 3 months ago, get us into that discussion as soon as possible so that we can start thinking about how we're going to make this happen on day one or soon after day one. If you come to me after day one, that's a whole different story, right? So it's being engaged.
You move into the reactive culture, or you're reacting.
You're back to reactive. Yeah, that's right. Yeah.
Do you push that up? Getting yourself kind of into those discussions, do you push that up through almost kind of like a fear of cost, showing them kind of in a risk, or do you do it the other way from a value-based standpoint?
Really, you got to think about the fact that once you get the top of the organization to realize that IT is a strategic part of the organization, and if you're making strategic decisions, you need to be at that table. So you got to earn and show that you belong there, not just from a cost perspective. Of course, I need to know what it's going to cost to bring the IT parts done, but really because you're not just talking about IT, you're also a part of the leadership team. You're a general manager that they can count on to come up with other ideas, other solutions to things. So you got to earn that right. And I think we all as CIOs have the ability to do that, but it needs to be the one at that table. We have a weekly meeting to evaluate these investments that we're thinking about. And I'm sitting there, right, listening to these investments and providing the input that I can provide in any one of them.
Makes sense. So I feel like we kind of covered a lot of the foundational aspects of this, and I want to use that little nugget you gave me to bridge into the fun part of the conversation related to you had the seat at the executive leadership team. How do you see the CIO's responsibility or opportunities to bring kind of new emerging technologies to the forefront into your leadership group?
So we have traditionally kind of sat back and let the department tell us what they need, right? And then we react to that, back to that reaction, right? We need to be proactive. We need to be able to bring solutions to the table, not wait for people here to give us orders. We shouldn't be order takers. Right? So if we have a seat at the table, not just with this system level leadership, but at each of the hospitals, at each of the facilities that we manage, we have to have people that are sitting there, listening to them, and proactively bringing solutions to them. So that's absolutely critical that we don't sit. And I have liaisons for each of the major parts of the organization. I have a liaison from the leadership in IT that sits with the leadership of that organization, because we need to be at that table and get ahead of these requests. Or if they have an idea, help them flush that idea out, right? And now you're adding value. You're not just sitting there, right?
So do new ideas and innovations, it sounds like they often come from feet in facility challenges or opportunities, and then understanding those and then kind of pulling them up and saying what technology can solve that particular problem versus another way around where the technology can come in and kind of open up a problem. Maybe just talk about those two different ways of innovating.
So some of the worst days for a CIO, right, is when somebody comes from one of the departments and say, guess what? We just bought this solution, right? And now you have to manage it and support it. So we have to absolutely stop that. And the governance model that we talked about before helps with that. So we don't get those surprises anymore. But the key is, once an idea germinates, right, we are at the table to help take that idea, and maybe it goes nowhere, but there's a good chance that it's going to end up being a solution that we then implement it. The other good thing about that is that, back to application regionalization, right? We have way too many applications in our organization. And how does that happen? Because people go out and buy their own solutions. So if you have an idea of what you need, tell us what the needs are. Let's look across what we have and say, here, we have something here that provides 80% of what you need. Right? Can we use that? And you wouldn't believe the number of times they said, oh, yeah, absolutely. Right? And now what? You have a solution that you can deliver now. So forget about that issue about IT being late all the time. Now you're there. You're going to provide that solution now. And you're saving us a lot of time and effort evaluating what's out there. And you're managing your applications the right way. Get more value from the applications you already invested in instead of just adding more applications.
That makes sense. When a question from the crowd and kind of around this concept. So we have some folks that are entrepreneurs and running and managing digital health startups. And so how do you best think about a digital health startup who can solve a particular workflow or has a particular piece of emerging technology kind of selling into a health system? What's the best path or process for them to kind of move themselves into an organization? Granted, and I think we all know it's really hard as well.
Yeah, it's very different, but we have that every week, right? I have that every week where somebody's coming to us, and especially to me, with a new way of doing things, a new way of improving a process, or a new device. And the best way to do that is, you may have champions outside of the IT organizations, but if it's an IT solution, make sure that you engage me. As the sooner the better. Because if it goes way too far and I'm coming at the end of that process, it's not going to be the same outcome. Right? So my advice is, absolutely, if it's nursing, work with a CNO, but make sure to suggest to the CNO to get us engaged as soon as possible. If it's a radiology solution, work with the chief of radiology, but then make sure that you engage us as soon as possible. So that's my big advice to you is, if you come through us, obviously you're engaging us, but if you're coming through another part of the organization, get us involved as soon as possible. Your chances are much better at that point.
That makes sense. It reminds me, I would say 7 or 8 years ago, Dr. Taveras, we as Manifold we would have probably been on your dartboard, because we entered in, we helped a lot of our clients, but we oftentimes were helping at a business line or a clinical level, and we were helping them, and we build clinical and business applications, and so we were building applications on behalf of the business or on behalf of the clinical team, unbeknownst to IT. And then all of a sudden, to your point, those products then showed up on IT's door, and they created a lot of heartache and headache. And then they weren't integrated, which is a problem from a workflow perspective. And then secondarily, we had all kinds of challenges from a change management perspective. And I think what we've what we've done with clients recently that's been very, very helpful to your point is like we've entered in on both sides of the house, right? As they work, we work with business line and clinical, and then at the same time bring IT into those right from the get-go, because you can build the greatest kind of product on top of from a patient engagement perspective, but unless it's integrated and kind of brought in and part of the whole part of your architecture, it's going to fail miserably when it relates to rollout and implementation and change management.
And Jordan, go back to the folks that you were helping 7 years ago. There's probably a reason why they went directly to you guys and didn't engage IT. They didn't have the relationship with IT. IT was slow in responding. There was no governance structure to drive this. So a lot of times the environment and the culture drive that kind of behavior. So it's kind of a circular relationship, right? You build a great strategy, you build a great governance model, you develop the right culture, you're collaborative, right? So they don't feel they have to go around you. They need to work with you. So it's all, that is a symptom of an organization that is very reactive and doesn't have the right IT environment for sure.
Yeah, I mean, again, 100%. The executives that we worked with back in the day, it was exactly that. It was, we see an opportunity in a problem space. We know IT is not going to move fast enough. We have to move quickly and fast. So it's really interesting. Do you, I guess, from a relationship building standpoint, as a CIO, what do you do, and what do you have your kind of one downs and your leadership team do to engage across the business from and build those relationships with folks? Because again, I think it's part of like being at the leadership table, but it's also the work oftentimes happens kind of below the leadership table as well, and those relationships have to be built. Do you have any thoughts and recommendations on kind of how you've seen things work?
Oh, sure. So I mentioned earlier that for each of the major departments, I have a liaison in the IT department. That liaison, and I join them as much as I can on a monthly basis. There's a call with the leadership to go over the tracker. So the tracker is absolutely critical, which is all the things for that department that we're doing in IT. So that's the level of engagement and relationship building that we have. They know what we're doing, and we report to them on a regular basis what we're doing. For major projects on that tracker, we don't wait for the month, because remember, we're going to give you a status report every Friday afternoon. So that's how you build those relationships. That's how you build that level of collaboration and trust, right? You can't forget about a trust. They need to trust you. They need to trust the IT department, because if they don't, they're going to go find you to develop something for them, right? So,
Yep. Yeah. That makes sense.
And you'll be more than happy to develop it for them too, right?
Absolutely. So we've got about 15, 20 minutes or so. I'm gonna shift, because I think we've talked about some of the core key pieces of preparing for value-based care from a data management and interoperability standpoint. We talked about some of the key needs in having the IT team be viewed as a value driver, and some of the relationships that need to be built across different business lines and on the clinical side of the house. Now, let's presuppose that we've done all those things within the organization, and we're ready to start to think about the future. And we're ready to start to think about how to manage patients better and drive quality or cost of care down. And we can risk stratify our patients and things like that. I guess maybe talk about some of the things that once you have your core system and infrastructure and culture built, what are some of the things that you're looking to invest in over the next couple of years to drive the organization forward?
So back to the procession of IT. I'm not here just to deliver solutions for today. I need to be looking 3-5 years down the road and say, where are we going to be in 3 to 5 years down the road? What kind of solutions are we going to need? Today, a lot of the answers are artificial intelligence, right? Generative AI and those type of things. So, but we need to be, IT needs to be at the forefront of innovations and make sure that we're bringing solutions, again, innovative solutions to the table before we're asked for it. So we're developing an AI strategy, and it's going to look at what do we have today, but also what are we going to have next year and the year after that? What kind of algorithms are going to be able to take advantage of so that we can predict what's going to happen in our organization, all different kinds of departments, so that we can now drive, not just looking at the rearview mirror, but really keep looking forward to where we're going to go. And that's the perception that IT needs to drive. That means that you deliver, right? You're not a reactive organization anymore. You're an operational excellence organization that follows processes, that delivers great value to the organization. And now you've earned the right to say, I'm going to look forward for the organization. So don't think that day one, if you're a poor organization, running organization, that you're going to be able to do that. You know, don't leap to that because you're going to fail. Wait till you get to those steps and you've earned the right to do that. But it's absolutely where IT needs to go. We need to be futuristic. We need to be visionary and drive the organization forward, because there's nothing that happens now in a healthcare system that we do not have a role in.
Mm-hmm. Mm-hmm.
Very, very little happens. Almost every device out there, from a bed, right, to everything else, now has computers associated with it.
So let's double click into AI strategy for a second, in the sense of, and not your specific strategy per se, but you talked about you're building an AI strategy, and maybe what does that look like over the next couple of years from a foundational standpoint? Like, what are kind of some of the things that you have to prove out, both to yourself at IT and then to the business, in order to kind of keep driving on that strategy?
Yeah, we need to find early solutions that are going to yield great results, especially with AI. So our major investments in AI right now are in radiology, because in the radiology space, we just do not have radiologists. There's a very big lack of radiologists across the country. So we need to make sure that we augment the radiologists with solutions that we have. So the main solutions that we have to that for AI are in the radiology space. And these solutions are great. They're proven to be so beneficial to the radiologist. They don't make the final decision. They don't provide the final diagnostics, but they absolutely speed up the radiologist's ability to do that. So you got to pick your areas where you're going to get the best results and proven solutions that you're going to bring into the space, because you don't want to be trying too many things and failing, right? That's not the kind of person that you want to be known as. So pick your areas. Absolutely there. The other area that is critical for us is, you look at the medical staff and they have a long day in the hospital or in the clinic, and unfortunately they have to go home and spend 3-4 hours doing notes. Right?
Documentation.
We need to absolutely help with that documentation. While the patient is there, while they're having the discussion, start building the documentation in the background, and that's going to be a great solution for AI. Many other areas. I think from a healthcare perspective, the biggest bang for the buck with AI is going to be in research. Using those AI models to drive research and personalized medicine, so many different ways, but it's going to be a big deal in research to be able to get so much data. And when you're doing your studies, when you're doing your research, you're going to get much better result. The limitations today is what we as humans can consume, which is an iota of what these algorithms and these machines can consume, right? So the results are going to be much better, much faster in terms of what we get from the research.
That makes sense. Does that kind of jump into your? I'll pull it back into, like, for yourself and into like a health system, being able to risk stratify your patients and having all your data from your system, and then kind of being able to layer Gen AI on top to get you insights into how to deliver better quality of care.
Oh, sure. Because now, again, we're going to have these algorithms that are going to be able to help us manage the patients today, right? But absolutely drive better care in the future. Think of gaps in care. Why do I need to have a doctor or somebody in the office look through your record to see what you're missing? You're due for your physical in 3 months. If you're diabetic, you're due for your eye exam. You're due for your podiatrist visit. Let the machine do that. Let the system do that. And by the way, don't automatically send that to the patient and say, these are the things that, so think about the power of that. Of course, you got to keep the medical staff informed, but think of the power of that, the system managing the patient, the system managing the population. That's where we have to go.
That makes sense. And I would, and then to connect into dollars and cents and culture and people, I think when you start to manifest some of those superpowers and get those and get those things going, it can be a real kind of wind beneath their sail from a clinical staff perspective, because that's part of those are things that they don't have to worry about as much. It helps them do their job better. They can become more efficient, reduces burnout, becomes a potential area for attraction of staff into your system and things like that. Which again, I mean, unfortunately, that's regardless of where you are in the country, staffing is oftentimes, challenge number one for organizations right now.
I mean, think about it. A happy clinician makes a happy patient, right? So we need to focus on our clinicians. You mentioned burnout. That's a major issue, right? And think of the solutions that we could have with AI and other solutions that can alleviate that. And if you have somebody that doesn't have that kind of stress, they'll be much better at caring for their patients.
Makes sense. So from an IT perspective, I mean, your purview is vast, right? Everything from security all the way to innovation. Thinking about it from an innovation perspective,
and don't forget clinical engineering too, right?
And that's a big one. Occupy some of your time. When think, just keeping on the kind of innovation train, and it was a question that we got, but how do you keep tabs on all the new innovation that's out there, and on not necessarily from a startup perspective, but even just kind of, even just the technology of Gen AI is moving so quickly, and there are so many different use cases out there. How do you any recommendations for how to help a CIO kind of corral it all and have it in a way that's digestible, and to understand where they should be pointing their organization?
Some people take the tact of going to conferences, and I can go to a conference every day, right? I mean, with the number of invitations that I get, right? But I can't, because we have so much to do. So I pick the conference I'm going to go, maybe 3, at the high end 4 a year that I'm going to go to. So that's one way of doing it. I also read a lot. So my suggestion to you folks is put stuff out there in the readings, and figure out how to get it in front of us in a written fashion, because I spend a lot of time reading and reviewing things. The other item is participate in your regional CIO groups. If you don't have one, create one, because we need to learn to help each other. You don't know how many times I get a question from my colleagues out there, CIOs, saying, what are you guys doing for radiology and AI in radiology? What are you doing with AI in this area? So we share a lot of what's happening, and that's invaluable to be able to do that and be part of that community. I'm also part of national communities, right? Because I don't want to just do it at the regional, but I'm also part of the national CIO groups to make sure that I'm part of, and a lot of time potentially give something to that group, right? As much as I get from them, try to give something to that group also.
Yeah, the group strategy is really interesting. From a conference standpoint, what are the 2 or 3 or 4 conferences that you typically go to?
Well, usually Vive and HIMSS are the 2 big ones. This year I'm going to go to the Becker's conference in Chicago in April, because I think there's be a lot of people there. But from an innovative perspective, you got to look for innovation also. Mm-hmm. I happen to be an hour plus from New York and an hour plus from Philadelphia. So I look for those regionals where a major organization is having a one-day session. Those one-day sessions are great. The dinner meetings, they're sponsored by different organizations. Those are great. So that's another way to stay in touch with everybody and stay engaged.
Makes sense. And then what are you reading? What are the you say you read a lot. What are the pubs and
the Becker's Daily? We have the Pennsylvania Hospital Association that gives us a lot. They amalgate a lot of information provided to us. You have Chime, the CIO organization. They collect information and share with us. So it's those type of things that we get on a daily basis that keep you abreast of what's going on. There's a couple of cybersecurity news organizations that provide that kind of information too.
Gotcha. Makes sense. So I think we got about 5 minutes or so. I just had a maybe career advice question for you for call it emerging managers in the IT space who aspire to move up to the CIO ranks. words of wisdom or kind of, I mean, you obviously went through a lot on things, but any thoughts to give to those folks?
Yeah, I'm going to be a little prescriptive here. So I have probably 5 things that I'm going to recommend to people, because you're an IT leader, but you're a leader within the organization and you have to act that way. So the first advice that I have is, I committed to be here with you doing this session. I can't be on my phone. I can't be doing my email. I can't be doing all these other things. It's kind of disrespectful, what I see a lot of times. People come into a meeting, they open their laptop, they get on their phone, right? If you can't be in the meeting, then don't come to the meeting. But if you come to the meeting, be in the moment, be focused, right? So make sure that you're respectful of other people that are in the meeting. And if you're at the meeting, pay attention and do that. Don't be distracted with other things. The other thing is, you need to always be the same person, right? So you need to be authentic. You have to be humanistic. But I tell people, if you see me up in the boardroom, or you see me down in my office, and then you run into me at the supermarket or at the ball game, I'm the same person. And you have to always be the same person. So be authentic and be humanistic with people. The other thing is, number 3 is that people are always watching us, right? As leaders, people are always watching you. So make sure that you model high performance. If you expect people to perform in a high performance fashion, you need to perform at that same level. So don't expect others to do things that you wouldn't do. Make sure that if you're expected to do A, B, and C, do D and E too, right? So make sure that you always go above what you're being asked to do. Uh, Another area that I have learned quite a bit in the last few years, because I certainly are always tempted to not do well in this space, is to be curious. Don't judge people, right? I'm very judgmental, and I have to hold myself back and say, no, I'm going to be curious. You know, I'm seeking to understand, right? I'm not seeking to question you. So I don't like to use the word why, because that's confrontational. Tell me what you're saying. Help me understand better, right? But don't use that word, because now you're confronting people. And the
Mm-hmm.
last thing is, I mentioned that earlier, but hold people accountable. But only hold people accountable after you've held yourself accountable, right? Look in the mirror first before you say to somebody else, why did you do that? Why didn't you do this? What did you do for that person not to do that? One simple thing is, and I make sure that I tell my leadership team this and everybody else on the staff, is communication is 80% of the issues most of the time. And that comes from not really clearly expressing yourself. So if I ask my team, can you please review this document and give me your comments back? I don't stop there. I say, I need it by noon on Monday. Not on Monday, because it could be 5 o'clock on Monday, 12 o'clock. No, by noon on Monday, so that we have very clear expectations on, they know what I'm expecting, right? And they can respond to that. If not, they give it to me at midnight on Monday, and I may be upset. I may have missed a meeting where I needed that information, right? So that's the kind of stuff that you need to do to make sure that you don't create issues and that you avoid all these communications issues. So again, those are 5, 6 different things that I think you really need to do to be a high performing leader, right? And a great manager of people, because that's what we really have to be. We got to focus on our staff and making them better. Does that
Yeah,
help?
I love
Yeah.
it. I love it. You're that was a great way to end it. Your folks are very lucky to work for you and kind of follow those key principles. You know, be careful. I might have to come knock on your door and come work for you.
Yeah.
I'm excited now.
Yeah.
Those are key leadership principles, and I thought really well articulated, Dr. Taveras, and I think helpful for everybody from me all the way to everybody who was joining the call. So
Yeah, and Joe, one thing that you just said that I'm really careful with also, with my leadership and everybody on my staff, which is, I never want to make them feel like they work for me. They work with me.
with
I
you,
may have
yep,
I may have different responsibilities. But we all work together.
it's a great
Nobody
point.
works for me. We all work as one team.
It's a great point. It's really
Mhm.
great. Well, hey, I very much enjoyed the conversation. I feel like we covered the gamut
Yeah.
of things, and I hope everyone who joined found the conversation insightful and helpful. We'll post a recording out to everyone, and then we'll also post our contact information if you have additional questions for myself or Dr. Taveras. Happy to have those conversations, and wish everybody a great weekend. And Dr. Taveras, really appreciate your time on a Friday. We talked about happy hour. It's happy hour your time, not exactly my time yet, but really enjoyed the conversation, and look forward to staying in touch.
Thanks for having me, and thanks for the folks who joined. Yeah.
See everybody.
Thank you.